Okay, so today we're going to talk about adrenergics. We have 5 different drugs in this class. And yeah, it's 5 different drugs. Okay, so we're just going to get started with the first page. First drug. The first drug we're talking about is Adrene. That is proamidine. Spell it for orthostatic hypotension. Classification of vasoactive adrenergics. So that means that it's going to turn on the sympathetic nervous system. This works on smooth muscle, which is postsynaptically. So it's after that synaptic gap between the neurons. It's going to work on peripheral vasoconstriction so that this can cross the blood-brain barrier. The adverse effects include insomnia and supine hypertension. Nursing implications are that you do not give this drug after 6 p.m. or 4 hours before bedtime because it can lead to insomnia and the supine hypertension. You need to tell your patient to increase fluid intake and to keep a journal of their symptoms. Excessive dosing may lead to central nervous system and cardiovascular system stimulation. Test your patient for allergies, asthma, hypertension history, heart dysmias, and heart disease. And before, you also need to assess their renal function, hepatic function, and their heart function. So that's Adrene. Remember, it's going to be for orthostatic hypotension. That's how you spell it. And that's the first. Again, since it's a vasoactive adrenergic, it's going to turn on the sympathetic nervous system. And again, there you have the same things that you assess for allergies, asthma, hypertension, heart arrhythmias, heart disease. You also need to look for renal and hepatic and heart function in your patient. But specifically for epinephrine, it can either be used for cardiac life support or for asthma or anaphylactic shock. That depends on the dose that you give your patient. So look here. For alpha, working alpha, it's going to be a high dose, which is cardiac life support. If it's beta, it's asthma, or that's a lower dose. So just think, you have to have epinephrine if the patient is dealing with their heart. So cardiac life support, I know that's not going to make any sense, but just think your heart takes a little bit more energy than your lung shock situation. Constriction, so that's an anaphylactic shock situation. The adverse effects depend on if it's alpha or beta. Alpha is going to increase the blood pressure with vasoconstriction. Remember, we just talked about that earlier. It leads to bronchodilation. So that's just some things to remember. Remember, with alpha, it's going to have vasoconstriction and it's going to have bronchodilation. So kind of BB bronchodilation. Nursing implications, again, since this is an adrenergic drug, is one of the drugs that inside the vial, it must be clear when you give it to your patient. If it's colored, you have to throw it away. So that's just a nursing implication that you need to know when administering this drug to your patient. So there we go, epinephrine. And the brand name is adrenaline. There we go. Okay, now we have more epinephrine. The brand name is Levophed. I think I said that right. Who knows? That's how you spell it. This drug is for hypotension, shock, and cardiogenic shock. And specifically, if the patient has not responded well to other drugs, that's when you would use this drug in the case of hypotension or shock. If the patient has not responded to other drugs. So again, this is a vasoactive adrenergic. It turns on the central nervous system. These not the central nervous system, sympathetic nervous system. These are the things you're going to assess for. Remember, we talked about them already with the past 2 drugs. This drug, the adverse effects are going to include vasoconstriction, but that's what you're expecting it to do anyway. So too much of it is going to lead to that. The method of action is that it's working by vasoconstricting on alpha, some beta 1, and this directly metabolizes into dopamine. Nursing implications, it is IV only. And again, you're going to have that thing where excessive dosing can lead to central nervous system and cardiovascular system stimulation. Again, this is where the vial must be clear in order for you to give the drug to your patient. Next, we have Dobutamine, which the brand name is Dobutamine. I hope I say this right. This drug is specifically for heart failure, and again, it is a adrenergic. So these are the things you assess for. The method of action that it works by positive inotropy. Inotropy is force. So think of iron, like if your iron needle is forceful, if you were to hit somebody with an iron rod, it would be a lot of force on one body part or whatever. So I always think of, I don't know. That's just how that's how I remember it. So inotropy is intensive shock, and it can also increase renal perfusion, which will increase urine output. There are no adverse effects listed here, but there are some interesting implications. That this is for continuous IV use. You need to always be monitoring that when you're doing your assessment checks. And excessive dosing can lead to central nervous system and cardiovascular stimulation. This drug will increase cardiac contractility, and this is one of the drugs that's an exception to that discoloration rule. It can be used for 24 hours after it's been prepared. So even if it was prepared at 12, if at 3 p.m. it looks a little discolored, you can still give it to your patient. This is okay. Just remember, this is an exception to that rule. Okay, the last drug we're going to talk about is dopamine, and this drug, intropin, I guess that's how you say it. Hope you can see that. The dose it is. If this is a high dose, it's going to be for cardiac. Dose that's more for renal issues. So dilate things. So cardiac needs the heart and the mesenteric system. The adverse effects of this. We don't have any listed here, but we do have a contraindication, and that's phenocystoma. So remember over here, we just talked about the high dose and the thing you're going to have to remember. Nursing implications, this drug is IV only. You need to check for vesictation again, so use a large vein if possible. And again, excessive dosing may lead to CNS and certain cardiovascular system. I just said something wrong earlier. Assess your patient for their allergies, their history of hypertension, history of heart dysrhythmias, asthma, heart disease, and you're also going to be assessing their renal, hepatic, and their heart function before you give them these drugs. So that's it for vasoactive adrenergics.